Many of you have asked us about the types of telerotation. So today we'll show you two different types of telerotations. Both of them are from our partner physicians. So you can see what a typical day for you will look like in a telerotation. So in this first type of telerotation that we are going to show you, we recorded it. You will have access to the patient information, patient history. It's so very similar to how you would do an on-site rotation. You will interact with the patient, you'll present cases to your attending, and you'll interact with the team. You may have access to the EMR information. You may be able to practice in the EMR as well, depending on the location. So take a listen and see how a typical telerotation of this kind works, where you are interacting with the patient over video.
All right, so we are in our exam room and we have Dr. Thompson, one of our tele-interns. Dr. Thompson, where are you working from today?
Hello, good day. I'm working from Jamaica.
Jamaica, wow. So Dr. Thompson is all the way in Jamaica doing a telerotation. And the typical telerotation setup in our clinic is he's set up through one of our health programs, Doxy. So he's able to see our patient, who usually is sitting directly in front of him. And he does the whole interview without my assistance. He gets the complete history. And then we connect his computer to our computer so he's able to write the note, set up the plan, place orders. And then when he's ready to staff, he sends a message to us that he's ready to staff. And then we come inside the clinic in the room, and then we discuss the staffing, and then the vitals are done while he's in the room, and then any physical exam portion he has questions about, we take care of. Can you give us anything else, or how your day typically is in the clinic? How many patients you're seeing? How long you typically last with them?
So a typical day in the clinic is usually a busy clinic. I'm able to see a wide variety of cases each day, ranging from simple complaints such as cough and cold to diabetes, hypertension, as well as the main thing, opioid dependence. Generally for the day, you see an average of about 7 to 10 patients. What I realize is that we're able to form good connection with the patients, even though it's telemedicine. Able to go through history with the patient. As Dr. Sal commented, the physical exam is done on site, and the plan of action is the discussion with Dr. Sal for us to see how to care for the patient. So I realized that it's almost like we're actually at the site, so it's no different than an on-site rotation, and you're able to basically take part in care of the patient in totality. So I think it's an amazing experience, and that's my experience so far.
All right. Well, thank you, Dr. Thompson, and appreciate your time. Now we'll bring you a patient.
Now let's look at the second type of telerotation, and this is didactic based. And in this case, you'll do a lot of case presentation, a lot of critical thinking. You'll discuss the protocols.
Hello everyone, this is Cedric Coleman from Rush University. I'm just here to have a little discussion with you regarding the telerotations that you've heard about. With the telerotations, we found out that one, we can focus strictly on the academic information regarding the patient. We do the history, we do the physical, we did everything we would have done as if the patient was there, only we did it talking to each other. But then we get to the academic part. We get to the part, this is the reason that people don't match in the program. They would have seen 1,000 patients with necrotizing fasciitis. But then when we talk to them about necrotizing fasciitis, they have no idea of what we're talking about. Because of that lack of knowledge is why people do not get into programs. When most of the telerotation programs we have, and ours in particular, everything is focused around the academic learning. You saw a lot of patients, you examined a lot of patients, but then you can't synthesize the data. We get to do both within the program. This year in our program, we had 180 students that matched in their respective fields. That makes us one of the largest programs if we consider ourselves a medical school, one of the largest classes to match someone in the program. And that's because we constantly review our data with Rush, with U of I, with Cook County, making sure that we're on target with what the program directors are looking for.
Now, this type of telerotations are offered at our partners at Rush University, Cook County, and there also you will have access to their simulation lab or sim lab. So in this case, you will see a lot of simulation modalities, mannequins, task trainers, and other students who are trying to learn, and you will interact with them as well.
Option of dying from not being able to breathe. Yeah. So other things like, how was her blood pressure?
Really shooting up.
Her heart rate was high. Her blood pressure initially was low. Yeah, it was low. Yeah. Right. So that's also gonna kind of let you know it's anaphylaxis too. With hypotension. Mm-hmm. Always want to add fluids. Oh, right. Okay. So for this case in particular, which I was torturing them, and so I didn't really get to. But the patient's gotten 8 albuterol nebs at home. So that is going to tell you already, this patient got 8 nebs. They got 8. It's okay. They got 8 nebs, and they're coming in, sleepy, and still.
So which kind of telerotation will fit you well? It depends. But if you have had no electives in the US, you've had no patient interaction because the CS was cancelled. So in such cases, probably the first model that I showed you may work well for you. But of course, you have to work on the US time. But of course, there are students who have extensive experience already. Many of you may have already done home country residency. Many of you may have done extensive rotations earlier on. But now you cannot travel because of all the pandemic issues and there are travel bans. So in such cases for you, probably the second model can work. So good luck, and let us know if we can help. If you're interested in any of these telerotations, I have the link below and you can check out those rotations.